Hi, everyone, and welcome to the Clinics Review Articles podcast series. I'm Taylor Hayes, the managing editor for Physician Assistant Clinics here at Elsevier. Physician Assistant Clinics is a quarterly publication consisting of review articles focused on a central topic for practicing PAs. Today, we will be discussing the October 2024 issue dedicated to advances in patient education, guest edited by Dr. Lucy Kibe and our current consulting editor, Dr. Gerald Kayingo. Dr. Kibe has served in various capacities as a PA, researcher, healthcare leader in the U.S. and abroad. She is a graduate of the Drexel University Physician Assistant Program. Prior to that, she received a Doctor of Public Health degree with a concentration in community health and prevention, also from Drexel University, and a master's degree in nutrition and dietetics from the University of Akron. Dr. Kibe is also a graduate of the Insights Leadership Fellowship from the Children's Hospital of Philadelphia and an inductee of the Alpha Eta Society for Academic Excellence and Leadership Achievement. Dr. Kibe has several clinical leadership positions, including Chief Medical Quality Officer and Director of Clinical and Wellness Services. She's devoted her life and service to the underserved by working at federally qualified health centers, serving individuals who are marginalized and/or experiencing homelessness. She has led clinical teams to design and implement protocols for strategic quality improvement for better patient outcomes. Additionally, she has pioneered wellness initiatives to address disease prevention and improve the quality of life for vulnerable patients, particularly those with diabetes and hypertension. As an educator, Dr. Kibe is a passionate teacher, mentor, and academic leader. She has taught several didactic and clinical courses to PA students. She has also been a clinical preceptor for many PA and NP students and served as the first director of an innovative doctoral degree program in Virginia. Prior to becoming a PA, Dr. Kibe was a public health researcher. She managed several NIH-funded research grants at the Children's Hospital of Philadelphia and the University of Pennsylvania. Her research interests include leadership, academic advancement for PAs, and improvement of healthcare outcomes in chronic disease. Dr. Gerald Kayingo is the Executive Director of the Physician Assistant Leadership and Learning Academy and an Assistant Dean and Professor at the Graduate School at the University of Maryland. Professor Kayingo has extensive experience in scholarship, education, leadership, clinical practice, and global health. He has practiced clinically both in primary care and endocrinology. Nationally, Kayingo has served as a director at large on the PAEA Board of Directors, member of the editorial board for BMC Medical Education. Kayingo has co-authored books on health professions education and published extensively on health system science and infectious disease in peer-reviewed journals. Lastly, he is the recipient of several awards, including a University Book Prize, the 2018 PA Student Academy Mentor Award, and the 2015 AAPA Research Publishing Award, as well as the 2014 Jack Cole Society Award at Yale. Hello, and welcome to the podcast. Thanks for joining me today.
Thank you so much for having us. We are extremely excited about this series, and I hope our listeners could get something positive out of it.
Let's start with an overview of the series. Dr. Kibe, could you give us some insight into what this series is all about and what inspired its creation?
Absolutely, Taylor. This series is designed to provide a comprehensive exploration of the evolving landscape of patient education. As healthcare becomes more complex and technology-driven, the way we educate patients must also evolve. So this series brings together experts from various fields to address the challenges and opportunities in patient education, offering practical strategies and insights that healthcare professionals can apply to their daily practice.
Wonderful. So as a clinically practicing PA, I've learned over the last couple of years that there's a lot of emphasis on disease, treatment, and tests, and very little attention sometimes is paid on patient education. Yet it's the cornerstone of patient care, especially in this era today. So in this issue, we wanted to highlight the role of physician assistants in leading the charge on patient education, PAs are often at the front line of patient care, making them uniquely positioned to drive improvements in how we educate and empower patients. I can't wait to see how our readers benefit from this issue.
Absolutely. So let's dive deeper into why patient education is so critical today. Dr. Kibe, could you discuss how recent developments in technology, patient-centered care, and healthcare disparities make this series particularly relevant?
Oh, yes. We are living in a time where technology is rapidly transforming healthcare. Tools like telemedicine, mobile health apps, and even AI are revolutionizing how we deliver care today. However, these advancements can only fulfill their potential if patients understand how to use them and how they contribute to their health. That is why effective patient education is more critical than ever. At the same time, there's a growing emphasis on patient-centered care. Patients today are not just passive recipients of care, they are active participants. They're making decisions about their health. And to do that effectively, they need to be well informed. So our series provides the tools and strategies healthcare professionals need to tailor education to each patient's unique needs, improving outcomes and patient satisfaction.
You are absolutely right, Dr. Kibe. The healthcare environment has changed drastically. You are right. Patients are active participants in the care that they receive. And for us to drive value and quality of care, we really have to pay a lot of attention to patient education. And let's not forget the healthcare disparities, where some groups of our population have it all, and then other members of our population don't have at all. So certain populations still face significant barriers to accessing quality care, and these disparities are often exacerbated by lack of effective patient education. So our series addresses these issues best head-on, offering strategies for reaching underserved populations and ensuring that patient education is equitable and accessible to all.
So, Dr. Kaingo, you mentioned earlier that PAs are uniquely positioned to lead in patient education. Do you mind elaborating on that?
PAs are trained in a generalist model. PAs practice medicine in all settings, from pediatrics to geriatrics, from primary care to psychiatry. So wherever there is care, you're going to find PAs. PAs are often the glue that hold the healthcare team together. They work in various settings, from primary care, as I said, to specialized practices. They interact with a diverse range of patients. This versatility of PAs makes them particularly effective in delivering patient education in ways that resonate with patient populations of different categories. PAs are also natural educators. They spend a lot of time with patients, explaining diagnosis, discussing treatment options, and ensuring that patients understand the care plans they have been assigned to. This series emphasizes the role of PAs, not only educating patients, but also teaching our other clinicians about best practices in patient education. By leveraging the skills and the positions, PAs can lead the way in making patient education more effective across the board.
Yeah, Gerald, that was really good. I really like your words that PAs are often the glue that holds the healthcare team together. I will add that PAs are also well positioned to incorporate new technologies to patient education, whether it's using telemedicine to reach patients in remote areas or employing digital tools to enhance understanding. PAs can adopt these new modalities and make them work for their patients.
So let's talk about some key themes and chapters in this issue. What are some of the standout topics that healthcare professionals can expect to learn about?
There are great themes in this series, and I think our listeners will really like how this series came together. One of the key themes is the integration of technology in patient education. We have chapters that delve into how digital health tools like mobile apps and telemedicine can be used to enhance patient understanding and engagement. Another important theme is health literacy and communication strategies, which are crucial for ensuring that patient education is effective, especially in diverse populations.
You are just spot on, Dr. Kibe. Healthcare is a team sport. So this issue really emphasizes the importance of team-based approach to patient education. This isn't something that should fall on one person's shoulders. It requires a collaborative approach across the healthcare team. So there are chapters that provide practical strategies for implementing team-based education in various settings, from hospitals to community health centers.
One more thing, Gerald, is that PA education, because it is very rigorous and very fast-paced, we don't have time to talk much about the economics of health education. But in this series, PAs and other healthcare professionals will find information about this. So it explores how effective patient education can lead to cost savings by reducing hospital readmissions and improving chronic disease management in the process.
So looking forward, how do you see patient education evolving, and how does this issue help healthcare professionals prepare for those changes?
Great question, Taylor. Really great question. So the future of patient education is going to be heavily influenced by the ongoing advancement in technology. As tools like AI and personalized medicine become more integrated into healthcare, the way we educate patients will need to evolve according to these technologies. This series provides a foundation for healthcare professionals to build on as they adapt to these rapidly changing technologies.
Absolutely, Gerald. We're also likely to see a greater emphasis on personalized education, where the content is tailored to the individual's specific needs, preferences, and health literacy levels. This series offers insights on how to implement these personalized strategies effectively.
Effectively is probably the right word to use here. Ultimately, our goal with this series is to equip healthcare professionals with the knowledge and tools they need to lead the way in patient education, ensuring that all patients, regardless of their backgrounds, have the information they need to make informed decisions about their healthcare.
Is there anything either of you would like to add?
I think another unique feature about this series is the fact that we look at patient education and how it fits into the different populations that we see in the clinic. We have patient populations that we see in hospital settings. We have patient populations that we see in primary care settings. We have patient populations that have disabilities, for example. We have patients who can talk. There are patients who can't hear. There are patients who are blind. So it's always very difficult for the provider to tailor education to these different patient populations. So we have in this series, we are very intentional to provide our readers, to provide our healthcare colleagues with tools that they can use to navigate patient education across these different populations of patients.
We also want to take this opportunity to thank all our authors that came together to put this series together, and our reviewers who reviewed those chapters to make sure they were accurate and that they would meet the need that was intended. Both the authors and reviewers took time out of their busy schedules to put this series together, and so we are very grateful for their time and their service to the profession.
Thank you so much, Dr. Kibe. You're absolutely right. It takes a village to put this type of information together. So I'm so grateful to all the authors and contributors that really put the effort to make sure that this information we have in this series is timely, is evidence-based, and is relevant to any clinician working out there in either hospital or outpatient.
Well, this has been an enlightening discussion, and it's clear that advances in patient education is a must-read for anyone involved in healthcare. Before we wrap up, where can our listeners find the series, and how can they engage further with this important work?
First, this series is available through the PA Clinic's website. You can access in both print and digitally, We encourage everyone to read it, discuss it with colleagues, and apply the insights in your practice. But if you are interested in diving deeper, we will be available at the PAEA booth at the PAEA Annual Forum just in the next month, October 2024, in Washington, D.C. Come and find us at the booth. We can discuss the series with you. You can have even the opportunity to engage with some of the authors and contributors. We look forward to seeing you at the booth.
Well, thanks so much for taking the time to speak with me today, and thank you to our listeners for joining us for this edition of the Clinics Review Articles podcast series. For an exclusive discount on the issue we discussed today, focusing on patient education, visit us.elsevierhealth.com/expert. Physician Assistant Clinics is available for individual print subscription with accompanying online access, as well as individual online-only access. It's also available on the Elsevier electronic platforms Clinical Key and Science Direct. For more information on this series and our nearly 65 other titles spanning all medical disciplines, visit info.theclinics.com, and be sure to follow us on Twitter at Clinics Reviews and subscribe to the Clinics Review Articles podcast series wherever you get your podcasts. Thanks for listening.